studies. This study is a few years old now, but I still use it because it's just real individuals' experience. So Israel has one of the most well-established medical programs. It's very different than ours here. You get a card and you just go find your own products and hope it works. In Israel, you get assigned to a clinic with a specific set of products where they track everything you're using and whatnot. So it's not randomized. These are just patients who get referred and use it, but we get good observational data. So this was a few years ago, but over 3,000 patients, a sick population, half had metastatic disease. You know, with 60% just going down the cannabis route, they were considered successful, meaning they had moderate improvement in symptoms and they stayed on cannabis therapy. You know, nausea, 90% improved in patients using cannabis. People who reported good or very good quality of life jumped from 20% to 70%. Again, pain markedly decreased, over a third stopping their opioids. Again, this is not definitive randomized control trial proof that cannabis works. These are just real people who were struggling. They got offered cannabis as part of their therapy and they did great. So if you want to ignore that and say that's not data, that's fine. I don't do that. I look at all the data involved, and especially what I hear from patients. Touch on this for a sec, because this is a question a lot of people have. Will cannabis treat my cancer? The short answer is we have no idea. The definitive answer, you should certainly not be using cannabis as a cancer treatment option in lieu of any conventional therapies. But obviously, sadly, there's people who we say many times we don't have any more treatment options. And so there's anecdotes of people using cancer or cannabis for that. Probably one of the best known is a leukemia patient who showed marked reduction, eventually died of a surgical complication that had her leukemia nearly reversed after being told no further treatment. That was published 5 years ago now. But there's no shortage of stories. But these stories we don't like to just repeat over and over again to have people thinking that's a treatment option. But there are randomized data for glioblastoma, so brain cancer. There is one randomized study showing cannabis in combination with chemo significantly improved outcomes. And there's lots of options. We know cannabis compounds literally kill cancer cells. There's been millions of rats that have been cured of cancer with cannabis, but we can't just say that's true for humans. Cannabis causes cancer cells to go into apoptosis or cell suicide. Cannabis will prevent cancer cells from making their own blood supply. Cannabis will affect gene production, which affects metastases. And this is THC, CBD, a host of other compounds in cannabis. But we find it's different for different cancers. We just don't have the data to use it. We hope that when someone's using it for symptoms, maybe it's treating their cancer as well. And there are folks who, for various reasons, aren't using conventional therapy most of the time because they failed all options. So we'll try it there. So certainly something to keep on the horizon. The last final, and again, this is some practical stuff, hard to apply to an individual because again, but it's often a starting part. So oral products are often best for maintenance, especially chronic things, symptoms you have every single day. You'd rather treat it preventatively than after the fact. Inhaled, immediate impact, and certainly for things like nausea and appetite. There's some rough range of dosing. Again, if you start at the low end, especially the THC, you're never going to run into problematic side effects if you go up slowly. So those are rough ranges per dose. So again, someone starting with that low end, 5 milligrams of CBD, a milligram of THC, may not work, but it's certainly never going to cause anything that you're not comfortable with. Just some other notes for some cancer-specific issues. Again, nausea and appetite. THC is really our workhorse here. Pain and neuropathy. Usually we're using combination therapy. It's a mouse study, but which studies shown CBD and THC worked for chemotherapy-induced peripheral neuropathy very effectively together. There was a non-randomized study out of Canada that showed using combination therapy preventatively showed reduced neuropathy, and so there's a lot of interest there. Anxiety is a key one. Anxiety is common with anybody these days. CBD, high CBD products are really what we want for anxiety. It doesn't mean no THC, but Small amounts of THC is anti-anxiety, larger amounts of THC is pro-anxiety. So you really want to use CBD dominant products and keep the THC dose down if you're treating anxiety. And then finally, this is just my reminder. I'm not going to go into detail, especially because of time. Even if you're thinking outside the box, beyond this set of prescriptions I've been given, cannabis is definitely not your only other option. It's a valuable one, but I would rather see people use the whole host of integrative tools that are available to them. So this might be other modalities, acupuncture, meditation, imagery, exercise, nutrition. That clip at the beginning from Cheyenne, at the very end, she said, but medical marijuana and good diet were life changers for her, life altering for her. Diet is always underappreciated, and so I look at cannabis as really a gateway to learning about some of these other tools. That's how a lot of my visits happened. And then finally, need more help. This is a lot of information I just threw at you. This can get confusing. It can be pretty simple. The one resource I'm going to mention specifically is called Leaf 411. It's another nonprofit. Also, I sit on their board. But this is a free resource. It has a variety of features, but its main one is a free nurse hotline, which means it's based out of Colorado. Anybody, I think it's 9 to 7, can call for free and talk to a cannabis-trained nurse and just ask whatever questions you want. It's outside the scope of their practice to make a diagnosis or to give you specific treatment recommendations. That's what a physician or practitioner like me does. They can answer all kind of, well, you said something about vaporization. I thought vaping was bad, and they can explain why some vaping might be bad and others is healthy. What's a ratio? What's CBD? Doesn't matter. Free resource. So they also have a lot of educational events throughout the year. So that's one I'll highlight. A lot of this other stuff is just things online. And as I wrote at the bottom, trial and error is okay for cannabis. This is pretty safe. If you start low and go up slowly, you can whittle down and find what's optimal for you. So use education as guidance, but there's no one size fits all, so you're going to have to do some adjustments. I'll pause there. Well, no, I'll stop there, take a sip, and give you guys a chance to collect your thoughts, and then happy to answer any questions you guys have. Yeah.
If you're at the very beginning of this, reaching out, how do you start? I mean, do I start with my oncologist, and if they're not into it, can they refer, or what's the best way to do that?
So a little bit will vary based on where you are. Some oncology groups kind of actively support and recommend it. I'd say that's less common. So yeah, I always recommend starting with your oncology team. Be like, hey, either I'm starting chemo, I want to incorporate cannabis, or I want to use it because X, Y, or Z is not going well. So start with them. They may say, okay, yeah, we can give you guidance. We've been using it in a lot of patients. Great. I'd say that's probably going to be 5% of people, maybe at most. Still, we want them involved because we want them to know what you're doing. And then it becomes very, well, what's the response? Like, no, you're a terrible human being if you use cannabis and I'm kicking you out of my practice. That happens. So sadly, it happens more than you might think. So that's a decision I might say, well, okay, I have to decide what practice I want to go to. A lot of it is, well, I don't know anything about it, do what you want, that's fine. And then you're kind of, okay, well, I'll let you know later. So then it's you can just go to a dispensary and say, I want to try cannabis. I went to a lecture, they said stay under 1 or 2 milligrams of THC to start, and you can talk to someone at a dispensary. It's very hit and miss. They certainly aren't trained to give medical advice, but they know about what products, how they're in theory going to act and things like that. So it's fine to just start. You can call a nurse hotline, like I mentioned, and just be like, I want to start. I just want to make sure I'm doing things safely and go. You can have a visit with a clinician, myself and others, that give more focused guidance and answer questions and go through your med list and medical history and things like that. So there's levels a little bit depending on someone's comfort and someone's complexity But in general, you can just start cannabis. Go to a dispensary, or you have a recommendation for a hemp CBD product that you can buy online and just start. Because again, but I recommend incorporating your oncology team, and I would say most of the education though that comes from patient to oncologist, meaning you come in, oh, let's refill this, this, and this. You're like, no, I'm good, I don't need any of that. What do you mean you don't need any of that? Fine, I've been using my tincture 3 times a day, and I take a puff of cannabis before my chemo. I'm good. You can educate them on how you came to that. So, and then in different states, it's going to vary. So in Colorado, you don't need a med card because we're an adult use state. If you're 21, you can just go purchase cannabis. There's no difference in quality between med and rec. It's just how it's taxed and dosing and things like that. Other states, if you live in a state that doesn't have adult use laws, you have to go through the medical process. And again, sometimes that gives you education, sometimes it just gives you legal access, and then you have to go outside that doctor for the actual education. So, like, I do a lot of consults for people all around the country. I don't know exactly what products they're going to be using, so it's a lot of 1-to-1 ratio with 2.5 milligrams or whatever. So a little bit depends on where you are, but it's fine to start on your own, just going to a dispensary, going to see a practitioner, or using a nurse hotline like that, or just your own reading is having some education before going in, I think helps.
So within that, like, the whole realm of integrative medicine is that we're not using it to treat cancer, not enough research out, but mainly to mitigate side effects so that you can keep that cancer dose up to hopefully a better outcomes. But when you were speaking about immunotherapy, which sometimes, research is so specific to whereas immunotherapy can be used to treat stage 4 small cell lung cancer, by itself. So without consulting a practitioner or having enough research out there, would you say that before we start anything in terms of a chemical that could potentially counteract the treatment, that we really do need to integrate this into healthcare so that, it conforms with integrative medicine? So kind of backwards in terms of, would you say that we really do need to have for each specific treatment enough research to back up if we should use it or not? Or that it is safe enough that even if it does inhibit some PD-L1 inhibition or such, that it's not so much that it will affect the cancer treatment?
Yeah.
That was all over the place.
No, and I'll quickly summarize what
I've had someone ask me about
Yeah,
this.
I'll quickly summarize to make sure I summarize accurately. What you're asking is that, especially for folks using immunotherapy, which is again across many different cancers, which would require different randomized studies for each of those cancers. What do we think about integrative tools like cannabis and that? And then there's the bigger thing, for cancer in general, we already have treatment protocols in place. Where does cannabis and other integrative therapies fit in? For me right now, those can be split pretty definitively. I would say for non-immunotherapy based cancer regimens, radiation, chemo, surgery across a wide range of cancers, I think we have enough research to be pretty comfortable implementing cannabis into a regimen. Almost every study that's been done preclinical shows cannabis to be additive or synergistic with chemotherapies of a whole host. Now this is again usually animals and cell culture. We typically see folks using cannabis have good outcomes. It's hard to just say cannabis users outcomes because often sicker folks with more symptoms who naturally are going to have worse outcomes might be using cannabis more, so we can't just compare those. But I think for non-immunotherapy regimens, I have zero concerns about cannabis. When it comes to immunotherapy, I don't think we're going to have to wait till we have randomized studies for every cancer, because again, which cannabis products are we going to study? but I think there's only 2 studies published to my knowledge. One showed actually worse tumor response in cannabis users, but same mortality outcome. The other showed worse tumor response and worse mortality in cannabis users. Again, no universal cannabis regimen. But that's enough to me to say we should at least pause. Now there's a couple caveats there. So I usually ask patients, okay, well, what does your doctor say about using prednisone? So if the doctor's fine with throwing prednisone into the mix, which is a potent anti-inflammatory, and they're saying, oh, if you ever have problems, take prednisone even though you're on immune therapy, I'm usually going to say, okay, well, I don't see why cannabis would be a problem if they're okay using other immune suppressants alongside it. And frankly, all those 16 cancers don't have a randomized study for prednisone showing it's safe or not. But if they're like, no, I don't want you on anything, I don't want you on fish oil, I don't want you on ibuprofen, I don't want you on prednisone, I don't want you on anything, cannabis would definitely fall into this, so I think you can be pretty absolute. The other thing, which might be a later stage, is a lot of people have to stop immunotherapy. Colitis being one of the biggest issues, but there's other flares of inflammatory conditions that happen. We don't want people to stop immunotherapy. I'm not an oncologist, but I've read enough to know it works pretty well. So cannabis might mitigate some side effects. It might potentially worsen the cancer response, but it might keep someone on immunotherapy. So I don't think they're mutually exclusive, but I definitely wouldn't start a cannabis regimen without having a discussion. But that's specifically for immunotherapy. And that would be true for other things, turmeric, any other anti-inflammatory regimen. I would kind of have a discussion before doing it in combination with immunotherapy. But for non-immunotherapy regimens, without second thought.
What about tyrosine kinase inhibitors?
Nothing should be specific there to my knowledge, although I'd have to go back and double check if there's any data, but it's not. In lectures, talks I've seen, it's not come up as a red flag, but I can't say that definitively. I just, off the top of my head, I haven't seen it come up, so I haven't researched it definitively.
Yeah, no, we just have a lot of patients on tyrosine kinase inhibitors, so they've asked and
Yeah.
just see.
Off the top, I can actually do a double check and get back to you and send it over, but off the top of my head, I have not seen that come up as a red flag. And so I wouldn't expect a problem there.
Thank you, super helpful.
You bet. Yeah.
I own a cannabis delivery service established for recreational and medical delivery in Denver and Aurora. I'm trying to connect with medical and, immunocompromised medical patients are my target market. Is there a way to find those folks? And then once I connect with them, what is the best way to get them the best quality product?
That's a good question. Connecting with patients comes usually two main mechanisms. So direct to patient, so going where patients are, or whether that's social media or things like this or whatnot, or going to practitioners who are making recommendations to those patients. So I think both are effective. I'd say with cannabis, direct to patient tends to be more effective because the number of clinicians that are willing to allow that to be part of the discussion is not that many. It's growing certainly as people see that. So I think it's developing kind of relationships and using both of those tools, and can chat more afterwards too. And from a standpoint of getting them the best products, I think a little bit depends on how your delivery system is set up, and is it, what kind of dispensary, how many dispensaries you have access to, what products you have access to. In general, because there's so much, again, complexity in different products, especially in Colorado, clinicians are going to do better when they work with a smaller subset of products. So, that's how it might be in Israel, where you have 8 different types of cannabis flower you can recommend to somebody, and maybe 8 different types of tinctures, Here I've got 20,000 products that in theory someone could use. So I think it's whittling down to a subset of companies or products, and then kind of having that as quote be a sell both to patients and practitioners, because when there's a smaller subset of products that are high quality and give you different options, ratios, and routes of administration, you get comfortable with those products and you can make adjustments easier. And if you know what a patient's doing, it's easier to make adjustments. And not every patient wants to track exactly. That works best, but if you know what people are using, it's easier to make fine-tuning adjustments. So I think finding ways to whittle those options down so people have diversity of choices, but diversity curtailed, so to speak.
Question. For companies that require random drug tests, how long does THC or CBD stay in the system? If you're a cancer patient, is there any flexibility with it?
So CBD is usually not an issue because nobody's checking for CBD generally. THC is what's checked for, and it's actually usually a metabolite of THC. So being positive on THC in the urine has nothing to do with your level of impairment. And it depends on how long you've been using and how much. I would say at the extreme, it's 30 plus days. So if you're a regular cannabis user, smoking every day or using edibles every day and have been doing so for months, you have to assume you're going to test positive. You have to assume a month, at least from your last use. If you went home today and said, oh, he said if I feel super nauseous, I can try 2 puffs and it might help, and it's the first time you've ever used cannabis and you smoked 2 puffs today, this afternoon, you might test negative in your urine 3 days from now, 4 days from now. So it really depends on the amount in chronicity, but for regular users, you have to give a solid month if you're worried about that. Yeah, and unfortunately,